we're debating the Affordable Care Act, as Christina said, people are paying premiums, but they're not even able to sign up right now after April, March 31st. So how is the pool gonna get any bigger if they can't even sign up anymore? That's just kind of what I'm wondering a little bit. Well, the ACA will negatively affect seniors. According to the impact of Obamacare on seniors, Heritage Foundation, the law cuts an estimated $716 billion from Medicare over 10 years. However, these savings are not set aside to preserve Medicare's future. Instead, they're used to fund more spending created by the law, meaning any savings that they would have used to maybe expand Medicare to maybe get more people covered is actually used to cover expenses created by the law. Also unaffordable, according to Obamacare raises prices on medical equipment. According to Jim Einstein, the Obamacare revolt, physicians fight back against the bureaucracy. When she was opening her traditional practice, Dr. Davidson witnessed firsthand how our payment plans for routine expenses drive up prices and block innovation. She recalls that one insurance company paid $118 for a routine PSA test. Now that patients pay the bill directly, the cost is $18. They're paying cash. She's not going through insurance anymore. She's trying a new thing, as a couple other physicians as well have tried. Insurance used to pay $128 for a bag of IV fluid. Now, she doesn't even bother passing on the cost of the IV bags because they run $1.50 each. To add to that, the ACA is fundamentally flawed. According to Elizabeth Harrington, Centers predicted Obamacare's negative side effects. For millions of Americans, Obamacare itself has become a pre-existing condition that has limited their access to quality, affordable health care, Coburn said in a statement. As we've warned in previous reports, Obamacare is fundamentally flawed. The law strengthens the hand of government and weakens the hand of doctors and patients. Obamacare is cutting choices, not costs, and costs will likely continue to rise. The ACA will result in compromised care. According to Jason Friedman, Institute for Healthcare Consumerism, Medicare's physician reimbursement mechanism is fraught with underpayments and perverse incentives. These underpayments are ultimately shifted to patients in the form of shorter visits, less doctor face time, and quick hospital discharges with compromised care. Meaning they're not getting their affordable visits. They're running something like 15-minute visits. And about business. The ACA is not good for cities. In an article by Andrew Johnson, 100 Unintended Consequences of Obamacare, hours have been cut for 200 part-time workers. These were the two options that they were given. Either cut hours for 200 part-time workers or take a $3.4 million hit. That was a decision the Southwestern Ohio city faced when it started weighing in on Obamacare impact. It opted for the former, meaning they just took the 200 part-time workers versus taking a $3.4 million hit. Part-timers had regularly worked more than 30 hours, but the city manager told the Journal News that their weekly workload has been reduced to 20 hours. Say in a year, 30 to 20 hours. That's the difference between 1,560 hours and 1,040 hours, meaning $23,400 to $15,600. That's $1,700 less. Say a person's making a little bit more money. Say they're making $31,200 on 30 hours. On 20 hours, they're out $10,400. They're essentially making less money because their business refuses to go into the Affordable Care Act, meaning they can't afford it. People are making less money, so how are they going to afford insurance and the $95 mandate adding up to over $55 billion total?
You have 2 minutes left.
This is one particularly interesting fact. Obamacare is putting a stress load on pediatricians. According to Scott Labiat, got Obamacare, too bad for you. Some plans will only include doctors in your local neighborhood. Obamacare dubs these executive providers organizations. Sounds great, right? Sounds a little exclusive. One of the more affordable plans he found in Florida has 7 pediatricians, not 7 practices, 7 actual doctors for a county with roughly 250,000 children. Anybody want to do the math? How many kids that is to one doctor? Coverage? Portable? About the job sector, Obamacare will cost over 2 million jobs. A CBO report, which we're certain you've heard about now, showed that Obamacare will lead to a loss of more than 2 million jobs here in the U.S. The Obama administration tried to swing that report as a good thing because it means more people will have the flexibility to leave their jobs. Flexibility to leave their jobs means less money, right? I mean, does that make sense? All right. And this one, physicians may not have a say in treatment. According to Jason Friedman, the Institute for Healthcare Consumerism, PCORI will recommend treatment regimens for the standard patient. These recommendations, coupled with reimbursement charges, could easily pave the way for government-dictated patients the medicines, tests, procedures, and medical interventions that they can and cannot have, irrespective of willingness to pay and individual preferences. This one-size-fits-all could replace the professional opinion of the physician. Basically, this means that physicians who went to school for 10 years, maybe a little bit longer, will not have a say in what their patients get to take as medicine or what kind of treatment they get to, take on. The government will have a say in that. That's, like my partner said, just straight coming into your liberties. You don't get to choose what kind of treatment you want for yourself, what's better for you as an individual versus better for, the one size fits all. Here's just the last example. Private practice offers more patient to doctor time. According to Jim Epstein, the Obamacare revolt, physicians fight back. Dr. Lisa, again, Davidson had 8 years of frustration running a traditional practice in Denver, Colorado. She had 6,000 patients when she decided to stop taking insurance and adopted the same business model. Her patient list has dropped to about 2,000. She used to spend 15 minutes with each patient, and now it's more like 45. We're on track to make more money and take better care of our patients. It's a win-win all around.